infection control. The most effective thing that you can do to prevent the spread of disease is to wash your hands. When should you wash your hands? Before making rounds, you need to wash your hands thoroughly using lukewarm water and soap. Wet your hands with warm water. Use liquid soap if possible. Apply a nickel or quarter-size amount of soap to your hands. Rub your hands together until the soap forms a lather and then rub all over the top of your hands, in between your fingers and the area around and under the fingernails. Continue rubbing your hands for at least 15 seconds. Rinse your hands well under running water. Dry your hands using a paper towel if possible. Then use your paper towel to turn off the faucet and to open the door if needed. When entering patient rooms, chaplains should use hand sanitizer, aka alcohol rub, when entering each patient room. No exceptions. How do you use hand sanitizers? Apply the product to the palm of one hand. Read the label to learn the correct amount. Rub your hands together. If you visit 15 patients, you should wash your hands 17 times. First with soap and water, then alcohol rub as you enter each patient room. And finally, to protect yourself and family before leaving the hospital, wash your hands one last time with soap and water. Chaplains should use caution when entering any rooms that have one of the following placards on the door. These placards do not mean, "Don't enter." These placards mean, "To enter with caution," and follow the instructions on the placards. Please check with the nurse before you enter. Soap and water only for hand washing. When donning and removing PPE, follow the following guidelines. Don before contact with the patient, generally before entering the room. Use carefully. Don't spread contamination. Remove and discard carefully, either at the doorway or immediately outside patient room. Remove respirator outside room. Immediately perform hand hygiene. Sequence for donning PPE. Gown first. Mask or respirator. Goggles or face shield. Gloves. How to don a gown. Select appropriate type and size. Opening is in the back. Secure at neck and waist. If gown is too small, use 2 gowns. Gown number 1 ties in front. Gown number 2 ties in back. How to don a mask. Place over nose, mouth, and chin. Fit flexible nose piece over nose bridge. Secure on head with ties or elastic. Adjust to fit. How to don a particulate respirator. Select a fit-tested respirator. Place over nose, mouth, and chin. Fit flexible nose piece over nose bridge. Secure on head with elastic. Adjust to fit. Perform a fit check. Inhale. Respirator should collapse. Exhale. Check for leakage around face. How to don eye and face protection. Position goggles over eyes and secure to the head using the earpieces or headband. Position face shield over face and secure on brow with headband. Adjust to fit comfortably. How to don gloves. Don gloves last. Select correct type and size. Insert hands into gloves. Extend gloves over isolation gown cuffs. How to safely use PPE. Keep gloved hands away from face. Avoid touching or adjusting other PPE. Remove gloves if they become torn. Perform hand hygiene before donning new gloves. Limit surfaces and items touched. PPE use in healthcare settings. How to safely remove PPE. Contaminated and clean areas of PPE. Contaminated outside frontham. Areas of PPE that have or are likely to have been in contact with body sites, materials, or environmental surfaces where the infectious organism may reside. Clean, inside, outside, back, ties on head and back. Areas of PPE that are not likely to have been in contact with the infectious organism. Sequence for removing PPE. Gloves, face, shield, or goggles. Gown, mask, or respirator. Where to remove PPE. At doorway, before leaving patient room. Remove respirator outside room. After door has been closed. Ensure that hand hygiene facilities are available at the point needed. For example, sink or alcohol-based hand rub. How to remove gloves. Part 1. Grasp outside edge near wrist. Peel away from hand, turning glove inside out. Hold in opposite gloved hand. How to remove gloves. Part 2. Slide ungloved finger under the wrist of the remaining glove. Peel off from inside, creating a bag for both gloves. Discard. Remove goggles or face shield. Grasp ear or headpieces with ungloved hands. Lift away from face. Place in designated receptacle for reprocessing or disposal. Removing isolation gown. Unfasten ties. Peel gown away from neck and shoulder. Turn contaminated outside toward the inside. Fold or roll into a bundle. Removing a mask. Untie the bottom, then top, tie. Remove from face. Discard. Removing a particulate respirator. Lift the bottom elastic over your head first. Then lift off the top elastic. Discard. Hand hygiene. Perform hand hygiene immediately after removing PPE. If hands become visibly contaminated during PPE removal, wash hands before continuing to remove PPE. Wash hands with soap and water or use an alcohol-based hand rub. Recommended that clothes that you wore to the hospital to round in be washed upon returning home. ARH infection control goals. Keep the patient safe. Keep you safe. Keep your family safe. Following these guidelines will reduce the number of contaminations. Chaplains must comply with all infection control rules. Quick recap. Wash your hands. Wash your hands. Wash your hands. If room is an isolation room, abide by the instructions. Always ask a nurse concerning visiting isolation rooms. Patients in isolation rooms may be some of our neediest patients. You are encouraged to visit isolation rooms following these guidelines and instructions by the nurse. Thank you for viewing this training. Your annually required certification of this training will be completed once you submit the form for the online training or sign the roster for the in-person training.